Good morning, everyone. This is Amanda Ruback. She began working at the Missouri Poison Center over a decade ago as a certified specialist in poison information, answering calls on the poison helpline. At the beginning of 2018, she completed her Master's of Science in Nursing with the emphasis in public health and now works as the Community Outreach Coordinator at the Missouri Poison Center. In this position, she coordinates education with schools, health departments, and the public across the state on topics related to poison prevention. Please welcome Amanda Rubeck.
Good morning, everyone. Thank you very much for joining me today. I'm going to try to get my screen going here so we can make sure I share my information with you. That's not exact. There it is. And let me flip it around. Can you all see that screen?
Yes.
Yep.
Great. So thank you, Judith. I am Amanda Ruback. I work as a nurse at the Poison Center, and I've been here about 10 years, as she mentioned. And so I used to answer telephone calls from the general public, so people like parents and doctors and nurses and adults about medicine questions and poison-related exposures, pesticide use, even venomous snakes and spiders, all sorts of things that are potentially poisonous. And we'll talk a little bit about that at the end, but the primary focus today I want to talk mostly about is medicine safety, which is not always put in the same category when you think about poisons, but medicine certainly can be considered a poison, and we'll talk about how that becomes one as we go along. So I'm very open to questions, and if you have anything you want to share, definitely put it in the chat or raise your hand, and we can get your questions answered too. So I hope today that we learn some strategies to take medicine safely. We learn how to dispose or discard of old medication safely, because that's something we all need to be aware of how to do it properly. And then what to do if a medicine mistake occurs. And so we're going to talk about all that and a little bit more as well. So definitely adults make mistakes when taking medicine. We all probably have been there where we've realized we grabbed the wrong bottle of something, or maybe took a double dose of something within a short period of time. And these are some general regular things we see with mistakes. So the wrong drug, maybe two spouses that take each other's medicine by mistake, the wrong dose, maybe taking more than prescribed or not measuring it correctly if it's a liquid type of medication. The wrong time is easy to happen. You forget to take your morning pills and it's noon by the time you remember. What do you do at that time? Do you make it up? Do you hold off? So kind of questions around that. And then just unintentional overdose, just mistakes and accidents that do happen from time to time. And then we certainly know there can be concerns with drug interactions with either other drugs or over-the-counter medications or food interactions. And so these are different types of things that people often have concerns with medicine. And I don't think it's surprising, but as we age, there are the potential for more health concerns, adding in more doctors and potentially more medications. So older adults primarily are at greatest risk for medicine related side effects and concerns. We certainly know that when we talk about medicines, we're going to talk about how we want to include any type of medications, both prescription, over-the-counter, supplements, vitamins, drops, and other things, and we'll look at that as well. And so as I mentioned, more medicines just ultimately can lead to more mistakes and more interactions. So most adults who are 65 and older regularly take at least 5 different medicines, and that's just a generic statistic. I do find that sometimes there are many older adults who are on very little medication, even no medication, and there are older adults who are on lots of medications of a variety of types. And so just think about maybe in your own mind how many different types of medicines you take, of course, considering those prescriptions and over-the-counter medicines and supplements. And of course, we take them all for health and wellness, but as I mentioned, more medication is more risky, more mistakes can happen. And we often know that that can lead to confusion and keeping everything straight. So think for a minute about how you organize your medicine. So some people use pill boxes or containers to kind of dose out their medications, and they have great habits of filling that in maybe on a Sunday evening for the week, and then they take those medications, and that's a great medication system. Other people go directly from the pill box or pill bottle, and that's fine as well if you can keep track. The main thing I want to encourage you to do is not, if you have a great system right now, if you do it the same way every day, the same way every week, I don't want you to make big changes, because also changes do lead to mistakes. So if you already have a system, just disregard this, because that can be a confusion. If you don't have a system, right? You don't have a way that you take your medicines every day, maybe putting it next to the coffee pot where you're going to have that morning coffee, and that triggers your memory to, have those pills with your breakfast and your coffee, or that pill box in a common place, maybe where you get ready in the morning for in the restroom or near your nightstand. So if you have that system, maintain that system. And if you don't, you kind of just take them when you think about it, or kind of use multiple different things. Kind of think about what would work best for your day-to-day needs. And so I know this picture is pretty dramatic. This is talking about side effects. And so the medical community, likes to throw around a little more big words. So of course we don't call them side effects. We have to call them an adverse drug event. And that's a term you might hear when you hear a medical person talk about side effects. And so obviously, even though medicines are meant to help us, when we take the wrong medicine by mistake at the wrong time, or we have something interact with one another, we certainly can have this effect. So for example, I'm assuming this lady might have a headache or some sort of medication related concern. And so when anybody is harmed by a medicine, we call that the adverse drug event or side effect. And so I just want to also mention that for older adults, medicine mishaps and interactions cause at least 700,000 emergency department visits each year. So that's a lot of effects or serious concerns coming from medications. And older adults are twice as likely to come to emergency department for medicine related effects, and then 7 times more likely to be hospitalized. So they're more likely to have those adverse effects that are serious, and then also be serious enough that they need treatment or further assistance in the hospital. All right, so just kind of think and ponder this question for a moment. I know without being in person, this is a little hard to interact here, but think about, what would you do if you accidentally took the wrong medicine or too much medicine? Let's stop there and kind of think about that question, part of the question. So I don't know, maybe would anybody feel comfortable in unmuting or putting something in the chat? What about what you would do? I know this isn't planned, but this is usually an interactive participation thing, so it's hard for me to keep talking. So think about, what would you do if you accidentally took the wrong medicine or took too much medicine? What would be your initial thought be or initial response?
Norman, do you have?
It depended upon what it was, but I would probably call my pharmacist if I was concerned.
Sure. Yeah. So there's probably varying degrees of concern, right? So if it was maybe a vitamin or, you know, a something like that, you might not have as great of concern. Maybe if it was something for diabetes or a heart condition, that could be a bigger concern. So yeah, it kind of might depend on what was taken. That's a good point. Thank you for responding. Anybody else want to jump in? So I do talk to a lot of people about this, and responses are varied. So some people go the route of great concern, right? They have that panic moment where they rush to the emergency room or they rush into to get assistance. So that panic is high because they're very concerned. And that's a very normal response to when a medication mistake happens. Then I have kind of on the other end of the spectrum, which is, oh, you know, a double dose shouldn't be a big problem with anything. I shouldn't be too concerned. And I think there's probably something to go in the middle about, right? We should ask those questions to somebody we trust, like our pharmacist, our physician. The Poison Center can be a resource to you as well, just to get that medical opinion and that expert advice. That also is reassuring, right? So if we ask, then we don't have to sit and worry about it all day. Sometimes people like to do the internet search of what would happen, and that can be often scary and kind of lead you in lots of different directions. So it is good to get that medical opinion, and that's what your physician, your pharmacist, anybody in your healthcare system should be able to do for you. Then the second point of that is what would happen if one of your grandchildren got into your medicine. That is something we see all the time at the Poison Center. About 45% of our calls are for kids under 5. So those ones that are getting into things, getting into those pill boxes and bottles and cleaners and all sorts of things. So that certainly is something to think about if you have young folks visiting your home from time to time. And again, it's honestly not just young children. We see that with teenagers and other people that might take advantage of a medicine or use a medication inappropriately. So it's something to think about as well when we store and keep our medicines in safe places. So medicine, when we think about and talk about medication, we want to know and mention that medicine is all sorts of things. Usually we just think about tablets and pills, right, when we think about our medicine, but these are other forms of medication. So many people have patches or powders or creams for their skin, eye drops and ear drops and sprays of various kinds. There are hormones and insulin that can be injected by needle, or certainly liquid medications, some that need to be stored in the fridge. And so think about medicine in the mindset that all of these things should also be included. So when we talk to our doctors, our healthcare providers about our medications, we also include these types of medicines, because while those pills are the one things we think about, some of these are the ones we take as needed or when we need something. And we often fail to mention these types of medicines for our healthcare providers. And then also medications, and this is obviously very basic, but medicines are in two general categories. Of course, we have our prescriptions, things that come directly prescribed from our doctor, nurse practitioner. You got to go pick up at the pharmacy or get them delivered in the mail. And then all those over-the-counter medicines that line the shelves of every Walgreens and Walmart you've ever been to. There's so many different types of things there, but we also must mention all of those supplements and herbal remedies and things to our physician and our healthcare team when we talk about medication. And so I did say at the beginning, I said, well, you'll probably be wondering why a poison center is talking about medicine safety. And so poison, we consider poison to be any substance that if it's used by the wrong person, in the wrong way, or in the wrong amount, can become a poison. So when we think poison, we think either strong chemicals or very serious things like arsenic and lead. And while those things are poisons, of course, medication can become a poison if it's used by the wrong person. So maybe that little grandchild got into something in the wrong way is very common. As I mentioned, sometimes we have two different things, like a bottle of eye drops and a bottle of ear drops, and we flip them around and we put them in the wrong place. That can happen, and we need to know what to do in that circumstance. And in the wrong amount, of course, is like a double dose or too much, intentionally taken for an effect. And so we also consider medication to be a concern in terms of poison. And this kind of just hits upon the same thing. And medicines can be poison if taken in a way other than directed on the label, or if a medicine's taken that isn't right for you. The one thing we don't often think about, and I know we all have concerns with how much medicine costs and the availability and insurance coverage, but it is important, if possible, to fill your prescriptions all at the same pharmacy, so that your pharmacist, as you mentioned, sir, they have that complete information when you call with that question, right? So if you fill it at 2, 3, 4 pharmacies to get that rebate or to get that special deal, they don't often have the same lines of communication. So they don't know everything that you're on unless you provide. They're not able to fully run anything like a drug interaction, or to make sure you're not on maybe a blood thinner or something that could be a concern with another medications. So it really is important to kind of use one pharmacy if possible. Obviously, there might be some restrictions to that, because I do understand, with insurance and cost savings, that's not always possible. But make sure at the very least that your primary pharmacy knows all of your medications that you're on, and that they're aware of those things. So if you do have those questions, they can respond to them. And then, of course, making sure your healthcare providers, your doctor, your physician assistant, your nurse practitioner know about your medications. I do know it seems kind of time consuming, and it seems kind of overwhelming to provide that list or bring in those medications every appointment, because I do know that they'll say, bring in your medications or bring in your list at the beginning of your appointment, and we'll confirm them. And it is important. And I know that many people, especially older adults, see lots of different types of doctors. So you probably have a primary doctor, maybe you have a orthopedist for joint pain, or a cardiologist or a different specialty doctor. And all of those different healthcare providers, all of those different doctors, sometimes they communicate, maybe if they're all in the same system, because we have these big hospital systems here in St. Louis that have electronic records. But if you see some that don't, we don't often know that the communication is not there. So if your primary doctor prescribes the majority of your medicines, and then your cardiologist adds something on, they may not be aware of the full picture, right? So we need to provide that for them. So that is why it is important and really key that when they ask for that full medicine list, you provide it in full, including the over-the-counters, the prescriptions and supplements, and all of those other non-tablet things, those patches and liquids as well. And so this picture I always show people, and it's always kind of a surprising look-alike. And so we know that there are lots of things. Poison centers are notorious for hearing mistakes happen because of things we call look-alikes. And so this is a little picture of different things. So on the, let's see, you'll see on the one that with all the labels turned around, it's really hard to tell what's what. You might think I wonder what, oh, I guess they're all eye drops maybe, or maybe they're all nose sprays. It's hard to tell. When we turn them all around, we can see that they're all very different. We've got a super glue with the red label. That wouldn't be real great in the eyes, but we've seen that by mistake because it comes in a similar dropping style bottle as a eye drop. The middle bottle, there's an ear drop. Certainly wouldn't be placed in the eyes, can cause some irritation there. And then the far right is an eye drop bottle, but all very similar. Imagine, you know, dry eyes in the morning, no glasses on, waking up from that sleep from the night before and you grab the wrong container. It does happen. So if we do see things in our home that are very similar, we want to keep them in separate locations. So if you do have two, like an ear drop and an eye drop, or a nose spray and an eye drop, you want to make sure they're stored separately to avoid mistakes. And then of course, all of those things that are not medications at all, like those glues and other products, are stored very separately from our medications. When I worked on the hotline, I had probably no less than 20 calls over the years about super glue in the eye. And mostly that came from these little foil tube that you see there, kind of super glue, because it looks a lot like eye ointment. If you've ever had a cataract surgery or you've had an infection to your eye where you had to put the ointment or the cream in your eye, that foil tube of super glue looks a whole lot like that. And, you know, it just is not a pleasant sensation, I imagine. It can certainly be a big concern for people. So it is kind of eye-opening, no pun intended, to see some of these things when you compare them side by side. And I'm going to show you another comparison. This might be a little busy, but I just want to show you other things that are comparatively similar. We've got medicines that look a whole lot like candy up there, the red medication. That's like a pseudoephedrine or nasal medication, next to some spicy cinnamon candies. So of course, young children can make that mistake, as well as adults who aren't paying attention. Then we've got sound-alike medicines. I know whenever I worked on the hotline and we'd have people try to tell us their name of the medication, we'd always have them spell it as well, right? Because we have so many medications that look, that have very similar spelling as well as sounds. So we've got glipizide and glyburide, both for diabetes. So you can't just say it's for my diabetes, because both of those are the same sounding. We've got Celexa and Celebrex, very different types. One's an antidepressant and one's for you know, pain and joint. We've got Xanax and Zantac, different medications as well. So you can see some of those listed there that I never go even, I wonder sometimes when I worked on the hotline if people thought I just didn't know how to spell these medications, because they can be rather confusing, or they, you know, I did say so many things sound the same, and I did often catch the wrong medication that they were taking. And then to even compound the issue, we have there the two pictures of the side-by-side bottles. Those are look-alike, sound-alike combinations. So we've got hydralazine and hydroxyzine in the yellow. Those are different medications, very similar bottles, similar names even. And then there's two antibiotics there in the bottom right, ampicillin and amoxicillin. Again, different things, similar labels and bottles. So just a note of awareness to kind of look at those look-alike types of things in your home, and to make sure that you are aware of the similarities and store them separately. And then I will also mention, I will mention that we often get calls from people as well who get a refill, and then the refill looks different. Maybe they wonder, is this the same medication I was prescribed the month before? And we do know that there are lots of different manufacturers of medicine. So maybe medicine 1 month might look round, white, circular, and the next month it might be a green oval. So we need to make sure that when you get that refill, if it looks different, to just check in with your pharmacist. They should tell you, you know, this is the same, but don't forget to ask. Ask those questions if it kind of bugs you to know, you know, this just doesn't look right. We certainly have seen where they've filled the wrong prescription by mistake. And then those, you know, mistakes happen. So if something doesn't seem right to you, it's very okay to ask your pharmacist or your physician or even the poison center, because we can look those things up for you. And then, of course, we have interactions. As I mentioned, certain medications can interact with things like alcohol. There are a lot of warnings on many different types of medicine, specifically Tylenol or acetaminophen with alcohol, and the amount that's safe to take with that. And then there are other herbal type things that have interactions. The one I think about mostly is certain blood thinners and ginkgo biloba. I don't know, I didn't probably give that very good justice, but the supplement ginkgo and certain blood thinners. So it's always important, as I mentioned earlier, when we talk about all of our medicines that we provide it to our pharmacists and to our doctors because of this very concern. And then, of course, there are food interactions. These aren't terribly common, but sometimes we will see a little warning label about certain types of blood pressure medicines having interactions with grapefruit juice, and you'll see don't drink grapefruit juice, and that's a very common one. There are less common antidepressants, that certain things like chocolate and wine are not a good mixture. So you will see labels like that on your pill bottle from time to time. They are often stuck to the entire face of that bottle and often confusing. So don't hesitate to ask your pharmacist, especially when you fill a new prescription, to make sure you can understand what is safe to take. And then I also just want to talk about, you know, just a few slides about how we have seen some changes relating to COVID and all of our pandemic issues, and how we have seen some increased poisonings. So we know that with COVID, we're all home more. Of course, I'm not able to be there with you in person. So when we're in the home, the majority of poisonings occur in the home. So if we're stuck in the home a lot more, we're more at risk for medicine mistakes and poisonings than any time other. And we're also using things more commonly. We've got our sanitizer out and our sprays out. We often are also taking more supplements or vitamins. So we have those things out and available more and more now. And then there's, of course, a lot of misinformation. It's not surprising that there's a lot of information going on right now about treatments and cures and safe things and unsafe things to take right now, and that's rather confusing. So when there's more information, it can be kind of confusing. And so with medication, specifically now, as I mentioned at the beginning, if you have that routine, keep it. Because when we change our routine, we have that increased risk of medicine mistakes, right? And as I mentioned, more and more people are taking increased medicine. So maybe you're ramping up your vitamin C, or you're taking some extra supplemental type things to kind of combat the flu and the COVID issues. And then if you're like me, most of us are a little more stressed and distracted now. We aren't able to get out of the house as much as we like and kind of be out and about. So that increased distraction and stress level leads to more medicine mistakes as well. And then sometimes we see just communication breakdown. So this may not be as applicable, but certainly see parents kind of and not talking to each other about giving their children medication. Did you give it to them? Did you not? And then getting a repeat or a double dose. So COVID specifically, unfortunately, has shown a greater increase in poisonings, including medication poisonings. And so I'm going to just talk a few minutes here about what type of medications are the most common. So this is actually from this year from 2020 so far to date, and this is the types of medications that people are calling the Poison Center about. All right, so the first one, we're gonna go down. So this is 10, kind of like a top 10 list, okay? So the 10th most common is antihistamines. And so those are our Benadryl, our Claritin, our kind of things for our runny, stuffy nose. 9th for older adults is blood thinners, so anticoagulants, Coumadin, and things like that, Xarelto, and all of those different blood thinners. So that certainly could be a big concerning category. Number 8 are things for our stomach. So a lot of us take antacids or things for laxative or anti-diarrheal type medications. Many are over the counter, some are not, and that's fairly common for older adults as well to have exposures. 7 kind of surprised me, but it's seizure medications, also called anticonvulsants. So mistakes with that, certainly double dosing could be a serious problem. So people are calling about that, older adults. Number 6, miscellaneous. Miscellaneous is kind of that catch-all, right? So things that don't fall in these other categories. So that could be, you know, variety of different supplements and things, and kind of a catch-all category. 5 are medications for mental health. So that could be for anxiety or depression. That could be a mood regulator like lithium or an antidepressant. So older adults are on quite a few different types of mental health medications, and we do see some errors and misuse in that. Number 4, all right, that was confusing because that is the antidepressant. Excuse me, I pulled that out separately. So the mental health medications would be more like for anxiety or mood, and then the antidepressants are more common than that. Number 3 are hormones, and we think hormones, that's kind of strange, but when we think of hormones, we also consider like thyroid hormones. So people have low thyroid disease, or even testosterone issues or other hormonal type of products. Number 2, most common is pain relievers. So unfortunately, it doesn't break it down into like over the counter versus prescription. But so think about the ibuprofen, the Tylenol, the aspirin, the different non-steroidal medications that are prescription, the narcotic pain relievers that many are prescribed after surgery or illness. Those all fit into that category. So that's a really big category, and also one that we have a lot of concerns about with older adults because of the sedating effect that we can see. Most common medication exposure for older adults are heart-related medications. So this includes blood pressure medicines or medicines to regulate the heart, like digoxin or other medications. So that fits a lot of things, especially if we include the blood pressure medicines. There are many different categories. So there's varying degrees here, and we can't make one blanket statement to say all heart medications are very serious or all antihistamines are not a big deal. It really is individualized based on the medication, how much a person takes, what other medications they might be on, how much they took, do they have problems with their kidneys or liver, making it hard to get these medicines out of the body. So that's why it's important, if an exposure or if a double dose or something happens, it's important to get that medical advice, because for one person, it could be safe, but for another person, we could see serious effects from. So let's do some concrete steps, some kind of things that we can do to prevent medicine mistakes. Here's number 1. And I think we all do a decent job about talking to our doctors from time to time. I do know that can be hard because often we get 5 or 10 or 15 minutes, if we're lucky, to have that quick office visit. So kind of taking the time to make sure your questions are answered is important. being prepared to go into your doctor's appointment is also very important. I always tell people, before you leave or the day before, take 10 minutes and write down 1 to 3 questions you want to know about when you go to see your doctor. So if it's your regular doctor, you could see, talk about what's the best exercise I should be doing, or is this medication okay with that medication? So write those questions down beforehand. I do it too. It's not just for people who are aging. You go into that appointment, you get flustered, you get that 5 minutes, and then they're out the door, and then you wish, oh, I wish I had a moment to ask those questions. I wish I had a moment to talk about this. I didn't get that question answered. So if you go in and say, hey, doctor, I have a couple questions, and they're written down and you're prepared, you're gonna be able to get better answers and clearer answers when you need it. And it's always very normal for people to come home, get that prescription, or get that, get home and realize that they failed to get their answers. It's always okay to call back and ask too. I know it's not easy. So that's point 1. And so point 2 for concrete steps is to really read and follow directions. We don't like to do that as people, right? We like to skim the direction list. We like to look at something and think we know what it is. But I do encourage you, especially with new medications, to take a few minutes and to make sure you're taking it properly. The label gives us lots of information. This is a standard medication label, drug facts label. Does give us lots of information about why a medication's used. You'll see the big warning section there about, allergies, and if you have a risk of stomach bleeding, things not to use. You'll see the dose, you'll see the time frame, talking to your doctor if you have a history of certain things like asthma and other things. So while these labels and maybe even the printouts that you get from your pharmacy can be a little daunting, especially those printouts when you print the label or the pharmacy medication and they tell you every side effect that might occur, and it gets kind of overwhelming. When your doctor prescribes something, make sure you understand the directions, because we often will get calls from people who are supposed to take something multiple times a day, but think they only need it once a day or once a week even, and be taking it every day. The second time you can ask about instructions is when you go to the pharmacy. So you've maybe got your questions by the doctor, maybe you still had some more questions. So when you fill something at the pharmacy, they should ask you every time, especially, with a new prescription, do you have any questions for the pharmacist? It's the pharmacist's job to give you that information. That is a perfect time. They're busy, I know. They sometimes look overwhelmed and struck, kind of not able to respond, but that is the perfect time to get more questions answered. Is there anything I should be worried about with my medicines in this? Are there any interactions you see when you run my medications? What's the best time of day to take this medicine? Are there any foods I should avoid? Do I take this medicine till I run out, or is this just as needed? There's so many different things that a pharmacist can answer, okay? So don't underestimate their expertise as well. So reading labels. Number 3 is to keep a medicine list, to keep track of your medicines, right? And so it's very important to keep a list of some kind, whether or not you're on 1 or 25 medications. It's very important to keep an accurate and up-to-date medicine list. So here's just an example of one that we have here at the Poison Center. There are lots of different ones you can print out. You could just handwrite. You could put an app on your phone. There are so many different things. So this is not the best one. This is just one I know about. And you're welcome to get from us if you would like. I'll give you my contact information. So this is like a little billfold size, and you put your medication and when you start it and how much to take and when to take it. But it also gives you those prompting questions. So in the middle there, what's my medicine? What does it do? How should I take it? What if I miss a dose? That's a great question to ask before you miss a dose, but something you can ask after the fact. Any side effects I should be aware of? Can I stop taking the medicine if I feel better? People like just to do that once they get improvement, to stop things. So this is just a handy little thing. Maybe you already have a medicine list, and if you do, great. I would encourage you to, in the next day or two, take a look at that list, get it back out from wherever it is. Make sure it's up to date with all of your medicines, your prescriptions, your over-the-counters, your drops and pills and patches and injectables, all of those different medicines. Make sure it's up to date. If you're handwriting it, I would encourage you to write it in pencil, because we do know that from month to month or visit to visit, things change, doses change and things. So write it in pencil, or, redo it when you have changes. And then make sure you also keep it with you. I know that's not always easy to do. So make sure you have a copy in your billfold or your purse or your handbag, or at the very least, make sure somebody you'd love or trust knows where it is in case of an emergency. Because it really is important. Maybe, heaven forbid, if somebody was found at the grocery store and they were unconscious, a EMT or a paramedic would know so much about you from looking at this list. They'd know, oh boy, she's diabetic. I wonder if it's her blood sugar. Or, oh boy, she's on 3 heart medications. That's a concern. So let's do this. Having a medicine list in case of an emergency is very important. So I would encourage you to find a way to keep it on you, and keep it with somebody you trust as well. Number 4, I don't go into this too much for this group, because, I did say keep your medicine where you know to take it. And we don't often have little crawling visitors in our home unless you babysit grandkids or have young people in your home. In that case, make sure your medicines are put away and out of sight. The most serious poisonings we see in young children are with their grandparents' medication. Getting a hold of the pill planner with 10 different pills for a 2-year-old is a very serious concern. So if you're home, it's just you or a spouse, keep that medicine where you need it, by the coffee maker, by the bathroom sink. But if you got visitors, just tuck that medicine away just for safety, because it is important not to make sure people have access to it, as well as pets. I've got 2 dogs, and as puppies, they were as much trouble as my kids were as toddlers. So just be aware of that. And then just some medicine storage tips. I'm kind of running down to the end here, just to make sure, if possible, to keep it in its original container. Keep different family members' medicine separately. So if you're married or living with somebody, make sure you keep those medicines in 2 different locations if possible, because we see that so often with medication mistakes. And then if you have liquid medications or things that need to be stored in a fridge, if possible, it's best to keep it away from food items, for the circumstance that people can mistake that for food and take medication, especially young children if you have those visitors. All right. So medicine disposal, I've just got a couple slides on this. So what do we do when we have extra medicine, right? We know that we don't always use our full prescription sometimes, or something changes, and we are tempted to keep our medicine just for when we need it, or keep that extra pain medication for maybe something that might be in the future, because medication is expensive. And so we want to make sure that when we're not going to use medication, or when it's expired, that we get rid of it properly. No longer should we be flushing medication in the toilet or dumping it down the drain. We see environmental concerns with that. We see wastewater issues, other things. So we encourage people to check with a couple different places. So many pharmacies, especially here in the St. Louis area, have either kiosks or drop boxes, especially those brand name, Walgreens, CVS certainly sometimes have those. If you don't see those, many police stations now in their lobbies have some sort of drop container. that's monitored. And so I would encourage you to just call the, not 911, but the after hour, sort of the backdoor number, to just ask if they have one or check in with them, because they often will have those for medications. And then I will encourage you, just coming up here in another couple days. It's actually Saturday. It's already this far into October. This Saturday from 10 a.m. to 2 is a National Drug Take Back Day. So this happens twice a year, once in April, at the end of April, and this Saturday. And so many city halls, and now this year is different, obviously, with COVID. Many city halls and municipalities have a drop-off just this day only. So I know that website's long, but if you type in DEA drug take back, DEA drug take back, you'll find, you can put in your zip code and then find a list of locations. There are many, many, many locations in St. Louis that day, depending on where you live, okay? So that would be a great thing this week as you fresh in your mind, because you've sat here and listened to me talk for so long, to kind of get rid of some of those old medications safely. Then if you are unable to do any of those, here's the home method. This is the least, we want you to take care of them out of the home if possible. That's always the best option. If you're unable to get out of the home, or because of COVID, there's issues, you want to mix your medication with something unpleasant. I always say coffee grounds are great. Lots of extra coffee grounds in the morning. So actually, you could put them in like a little Ziploc bag like that, or a little container with a lid. If it's warm, so like you just brewed that fresh pot of coffee and that coffee's warm, it'll dissolve those pills real quickly. If it's not, it's fine. The idea is that it's mixed with something unpleasant, so nobody's going to get into it, young children and pets. And then it can be put in your trash, household trash. And then make sure when you're getting rid of those pill bottles or anything with labels on it, you just protect your privacy. Your name's on there, your date of birth's on there, your medications are on there. So just either take that off the label or to mark it out real clearly so nobody has any personal information of yours. All right, and so just a few minutes about the services of the Poison Center. Poison centers where I work are all across the country. You see us there in St. Louis. Not too far from you guys there, where your center is normally. And we are part of 55 poison centers for the entire country. And so that 800 number that you might have seen, at 800-222-1222, works a lot like 911. So if you dial from a Missouri cell phone or Missouri landline, you'll get the Missouri Poison Center where I work. And what you see there is kind of where we're listed, but we cover the entire state. Here's a not great map because a little blurry, but you'll see there in St. Louis, we're red in color. We receive the most calls from Kansas City area over there in the far left, and then of course in St. Louis. But we receive calls from the entire state of Missouri, from every county, and that's nice, especially for people in rural areas that may have lack of ability to get into a hospital or to reach their doctor. And poison centers here's a nice picture of all of us who work at the Missouri Poison Center. We're all nurses and pharmacists. So I'm the far right there, this Christmas picture, but we're all nurses and pharmacists, as I mentioned, so we are specially trained in information relating to chemicals and medications, of course. We also have certification in poisoning and overdose. And then we also have a doctor that we consult with. So if something is, we need to talk about, a hospital patient or somebody has questions that we're not able to find information, we can consult with our physician 24 hours a day. So we're a service that can provide you help and information. And here's a picture of what it looks like inside the Poison Center. This is kind of like maybe what you think about when you call 911 dispatch. So we work on our computers and look up information. We get a call about every 8 to 9 minutes, and about 60,000 calls a year from the whole state. So lots of calls. And then if you need any information, we also work with Missouri Relay for the hearing impaired, and we have a translation line where we can speak to people in 150 different languages. So we really want to be a free resource to everybody who may need us. So feel free to call us if you have medication questions. You can't reach your doctor, it's the weekend, it's the middle of the night, feel free to give us a call as well. So here's my information. You're welcome to email me or call me if you need anything. If you need a medicine log or you want some more information from the Poison Center, feel free to call me directly or call our 800 number up at the top. So, questions? I talked a long time. Anybody have anything they want to talk about?
Looks like Norman. Norman?
I take a thyroid medication called levothyroxine, also known as Synthroid.
Mhm.
I have to take it about an hour before I eat, so I take it early in the morning. The thing I always wonder is, am I able to take that along with yogurt or fruit juices or coffee without waiting an hour for those three things? You know?
Sure, that's a great question, and it's not something I hit on when there are specific times for medication. So yes, it's best absorbed on an empty stomach. That's not always the case. In fact, it's more often the case where you do take medicine with food. So that one specifically, it is important to not take it with food substances. So I wouldn't do the yogurt, but you could do the coffee or the juice or other waters and liquids. So that shouldn't be a big concern, but I certainly would avoid taking it with anything high fat or kind of in that dairy based type of thing, because that would kind of delay the absorption. But that's a great question. So yeah, take it with your morning coffee, give it a little time, and then you can go ahead and have your regular breakfast if that's the time you want to do it.
Thank you.
You're welcome.
Well, I do have a quick question, Amanda, that I think maybe might be helpful to other people too, because so does the pharmacy, or I know our doctors probably track if we do take medicine, or even if we, take a medicine that's like just for a cold or an antibiotic type of thing, but you're regularly on something else. Would the doctor be the person that would kind of track the other things that you may be on, or would it be the pharmacist, or who? I mean, because we in general, let's say we need an antibiotic and like, okay, you need an antibiotic, here's your prescription.
Yes.
But you're like on something else.
Mm-hmm.
And so like they should already know that, but
right, that's the point, right? They should, right? And so it's important to kind of advocate for yourself. So to make sure that you did provide that list to them, and then to ask, is there any concern with the medications I'm on? So yes, that should flag when the doctor puts, especially now with computerized charts, which are so helpful for doctors, that should flag an interaction. And it should also flag maybe an interaction at the pharmacy. But it is your responsibility to just be that advocate. And I would encourage you to do that for yourself, or to appoint somebody who is. I'm kind of my mom's advocate, because her daughter, who's a nurse, she likes to have me around for those types of questions. So don't always assume that they made that check. I always, when I get prescribed something new, I always say, to that pharmacist, is there any drug interactions with what I'm on, and then make sure they have it. So yes, just like anything, they should be making those checks, but as humans that are busy and oftentimes restricted that doctors are, sometimes it doesn't happen. So yeah, encourage that advocacy for yourself, or have somebody that can help you to do that.
Yeah. Anyone else have any questions today? Looks like, you might have a question. Wait, we got to unmute.
He's muted.
you, you need to unmute yourself. I can't unmute you.
It's usually in the top, and if you put your little arrow up on the top, the little menu will come down. If you see that.
Oh, there we go.
There.
Okay. What do you do if you see in the paper that certain medications they say are causing cancer, like metformin?
Yes.
What do you do at that time? And also, I have a question about snake bites too.
Okay.
What do you do if you have a poisonous snake or another animal that's poisonous? What do you do?
Okay, sure. Yeah, that's a good point with the metformin that's been in the news this last week or so. And that's a medication a lot of people are on. So the best thing to do is to reach out to your doctor before you make any changes. So nobody should be stopping medication without speaking with their physician who prescribed it. That's important because some medications, when you stop them abruptly, not necessarily metformin, but some when you stop them abruptly, you might have issues with that. And then doctors play that risk to benefit thing. So would you be at more risk of not having your diabetes controlled because, or whatever you're on metformin usually is diabetes, or are you at more risk of this cancer that is potentially a cause that they've seen? So they can help weed that through. I know that sometimes you can do that over the phone. Sometimes you gotta make that special visit, but not to just jump to stopping something because you read it in the news. And then if you have further questions, those are questions you can call the Poison Center about, and we can look through some of the risks as well. But your doctor who prescribed it is a great resource to start that conversation before you make any adjustments. And then the snake bite. Everybody loves to talk about snake bites. And they're one of the more interesting things we get calls about. So if we know it's a venomous snake, which we don't often know, we just know maybe somebody was walking and they got bit and they didn't see it, or they're not sure if it's venomous. We don't do anything that you saw in the movies, right? So if you see Indiana Jones or you see some of those movies, anything that they do in the movies is not effective. So no tourniquet, so no bands or any constriction, no sucking the venom out, no puncturing the wound and making it bleed, so bleed that venom out. You're really gonna keep it clean like you would any wound. You're gonna elevate it, keep that elevated. And then don't apply ice because that could actually cause tissue damage. So it's kind of surprising. So with swelling, with venomation, you don't apply ice. Many times that then requires you to go into a hospital for treatment depending on the symptoms. So it's best to, if you're having minor symptoms, to call the Poison Center. We'll give you information. If you're having life-threatening or serious symptoms, passing out or having vomiting, then definitely go into the emergency department for a venomous snake bite. But about majority of our snake bites are non-venomous, and people who think they're venomous. So we often get confusion with that. And then even venomous snakes have a dry bite about 25% of the time where you're not seeing symptoms. So it's fun information, but yeah, we do have 5 types of venomous snakes in Missouri. We have 2 types of venomous spiders. And those are our main culprits for critters, I would say. So good question.
Okay,
What are
thank
the
you.
spiders?
That's another question.
Amanda, what are the spiders? Probably brown recluse. What's the
Brown
other?
recluse and the black widow,
Oh, okay.
less common. But brown recluse definitely fall right now is big brown recluse time. They're coming in from the cold, they're nesting. So be aware in dark, damp places like basements, shoes, garages, just kind of be aware this is a time for that. Yes, ma'am.
What do you do if you take your medication at the wrong time? Like you take morning pills and night pills, but you accidentally take the night pills in the morning and
Yes.
you've already had the morning pills.
Yep, we see that all the time, taking twice in one day or taking the wrong time frame. So it does vary depending on what the medications are. So I can't really say for anything you do this, excuse me. So it would be best to to call and get information either from your pharmacist or us. We would talk about each medicine and how far apart they were, the spacing, whether it was an hour or 12 hours, that's a difference. And then we can also provide you information on what to do next. So do you take them again the next morning or do you not? But it really does vary depending on what it is. So there's not like a easy blanket information for that,
Okay, thank you.
but very common.
That's it.
Does anyone else have any questions? I think we're good.
Uh,
Well, thank you so very much, Amanda. I think this was very helpful, and we can share her contact information in an email.
Yep.
With anyone that was here and the other registrants that weren't able to make it today, so that they have your contact and can call the Poison Center if they need to.
Absolutely. And if you need anything like magnets or you want something for your home, a medicine log, just reach out to me and I'll get you something in the mail as well.
Great. Thank you very much. I
Thank you.
appreciate
Thank
it.
you.
Thank you.
Thank you very much.
All right. Have a good day, everyone.
Bye-bye.
Bye.
Yeah, I was asking Ruth, you're out of